Greetings and welcome to the first webinar that's being sponsored by PTACC's International Deflection and Pre-Arrest Diversion Strategy Area. We are going to talk today about PTACC in the UK, how the first international chapter came to be. And Jason and I are actually co-chairs of that strategy area. So I've had the pleasure of working with Jason and watching the UK Deflection chapter develop. And I'm really pleased to bring the story on that evolution to all of you here today and those of you that are joining us at a later date by recording. To start off, Jason, do you want to introduce yourself briefly to the audience?
Yeah, thank you, Michelle. So I'm Jason Pugh. My background is in policing. I'm a former Detective Chief Inspector with Thames Valley Police in the UK. And towards the end of my career, I developed diversion schemes, slightly different to deflection, which we'll explain shortly. But my whole professional career has been guided by a public health approach to policing wherever possible, and that's what I do now. So I proudly lead PTACC UK.
Great. And my name is Michele Worobiec. As I mentioned, I had the privilege of co-chairing our international strategy area with Jason. I have a justice background, and deflection is near and dear to my heart because it gives police an opportunity to work with individuals in the community that need treatment and community-based services. These are not kind of these typical court cases that need involvement, and so it's been a partnership field of deflection. The other thing I'll mention before we launch into our interview is that we will invite questions and answers at the end of our interview. You'll notice that there is a Q&A box, so if you're attending this session live, feel free to type in your questions whenever they come to mind. And then once we are finished up with the questions that we had planned to discuss, we will open it up and address your questions as well. So Jason, I think everyone here is curious, and I know I am. How did you first find out about deflection?
Yeah, well, good question. I think I fell into it by accident almost. I think professionally, obviously, I was guided by public health approaches to policing. So I always had and in fact, I heard this at a presentation from ISA, and the police are the largest outreach network in the world. And I thought, that's actually really true. But actually, as a police officer, you analyze that and think, how on earth have police got time to be an outreach worker? But actually, when you look at the statistics about policing, 80% of all police activity is about social work or social matters. Only a very small amount of time, 20%, is regarding crime and investigation. So actually, the primary role of a police officer is very largely towards social and environmental and community matters, not what you see on TV. You know, the hard-hitting detective, or the drug busts or the armed cops. That gets all the fanfare, but actually the large part of work is about public health approaches. So I developed a diversion scheme for drug possession in Thames Valley Police, and that was pioneering at the time because it used a legal framework, a legal outcome to deflect someone away from the criminal justice system. So I was using deflection without truly understanding what deflection was, but under the umbrella of diversion. So when someone was found in possession of a controlled drug by police, the next person that individual would hear from would be the drug service. So the police actually could then step back immediately. But what deflection is it's putting the community way before the police are involved at all. And that, to me, makes perfect sense. To get there, though, is a little bit more difficult. And obviously, that's what we're going to talk about in a moment. But so that was my route to finding out about deflection, was through accident. I didn't really realize what it was until it kind of hit me, if that makes sense.
So it sounds like you had kind of a twofold encounter. One is, and we know deflection is one form of diversion, right? It's diversion before arrest, so you don't have to go into the court system at all. that you were already looking at it from a community perspective as we need a different response other than to send people with drug possession into the courts. And then you also mentioned hearing a presentation from ISUP. I just wanted to make sure our audience knows that that is the International Society of Substance Use Professionals. So you had kind of this twofold approach, and I really like how you're helping us reframe the role of police, or to remember what the role of police, because I know here in the US, we have a 911 system, and now we're coming upon a 988 system. And so when you have an emergency, you call one of those two numbers and you have an immediate response. But we're inviting police officers to reframe that this isn't necessarily a crime. This is an emergency with some urgency, and allowing the police to decide what is the appropriate response. So does that sound about right?
Yeah, it does. And I think culturally, police officers, you have, I mean, as policing is a career, and you evolve throughout that career. So as a young police officer, you know, I came out of the military and I was highly trained. I came into policing with that mindset of being highly trained. I absorbed the law, I applied it like RoboCop, you know, to the letter, you know, and you robotically apply what's taught you. You're young, you follow the rules. It's only when you begin to see the potential harms that policing can unintentionally cause. So arresting someone for possession of drugs, as an example, can cause untold harm to their future career, for their access to recovery and treatment, if that was right for them at that time. It also heavily stigmatizes drugs and so on. And then also over-policing underrepresented communities or over-policed communities. There are all these harms you don't ever consider when you're first joining the police or first start out. So you just robotically apply it. It's only later on, or depending on how trauma-informed you are as an individual or a police officer, you begin to realize there's a much wider context to society and community and harm reduction and vulnerability. And actually policing, again, going back to that 80-20 analogy, is 80% social harm, problem solving, you know, support, compassion, empathy, all of those, you know, perceived softer sides to policing. And I think what we need to try and do is to empower, recognize, reward all of that thinking around compassionate policing. And you know, and whereas at the moment it's very much, you know, it's championing all the kind of the hard hitting, easy to do enforcement focuses. And there's a political side to this as well. Sorry to labour this point, actually, it's quite important though. But politics and ideology really do influence policing, and that, you know, officers just affect those laws, those policies that trickle down. So sometimes it's not the police officer on the street or that community police officer's fault. It's about trauma informing, and I think the community have a responsibility to help trauma inform that, you know, their police force. After all, police are the community, and the community are the police, and we can only police with consent of our communities. You can only police by consent. If you lose the consent of that community, well, policing is now ineffective. So it's about, you know, the community are the police, and you've got to always remember that. Sorry that was long-winded, but I think there's a really important point about the actual role of the community in all of this.
No, those are really important parts, and we have plenty of time to talk about those things. I think that's what we want, is an informal conversation, no PowerPoints involved. And we would really just like to explore, what does this look like in general? What does it look like in the UK, so that we can inspire other countries to see how deflection would fit in to the work that they do. And so, Jason, I'm going to jump off of your point a little bit as well, and share, and we were just on another call that we were talking about this point, so it's at the top of my mind, that this is really a shift in policing, and we've seen that in the United States as well. When I grew up, there was a war on drugs, and now our data, our science, our research, our prisons all show that was not the correct approach. And so shifting toward that health approach that's trauma informed, that's compassionate, that links to services in the community is something very much in line with what we're doing in the United States. As a matter of fact, deflection is now part of our national drug control policy. And I believe, Jason, that it is entered into those official ranks in the UK as well. Is that right?
Yeah, and that's massive. That political permission is huge. It really is. The national drug strategy in the US, that's compelling. That will influence governments worldwide. And policy makers worldwide. But equally in the UK, it's now diversion is part of that UK drug strategy. For the first time, you see the words diversion or deflection within strategy. It's a huge game changer, and it enables police the permission to open that gateway to the community to come in. If that makes sense?
It absolutely makes sense. So it's obvious that we are both very enthusiastic about deflection and see all the merits. So let me ask you this. What was the initial response when you brought a deflection approach to your community? I'm assuming that there were some people that might have been a little skeptical, and maybe even some of your officers. So can you talk about that a little bit?
Yeah, that's a really great question, actually. So initially it was mixed, I have to admit. I think, so I'll tell you a little story, actually. I'll take you down memory lane. So in order for the police force to move towards a deflection model, we had to have political support. We had to have, wider permission, if you like, because the policing, although it's immune from, also impartial from political interference, policing in the UK, it's very isolated. The police chief can operate, individually, and obviously if everything's evidence-based and with the will of the public, of course. But largely, you have to have the permission of the policymakers. You have to have permission, if you like, or collaboration with those in political power. So to do something quite pioneering and perceptionally radical, we had to get our ministers involved, so or at least aware and not too adverse to what we're trying to do. I'm beating around the bush because the minister involved in our area was the current Prime Minister. Well, not the current, not Rishi Sunak, but Theresa May, the former Prime Minister. And because she was a member of Parliament for the particular area where I policed. And it was only following a drug-related death of a young woman and the inquiry about that death when I was a detective inspector, that I was able to have a one-to-one, a conversation with Theresa May. And we were able then to talk about drug policy openly and compassionately. And that opened the doors to an opportunity for deflection, for diversion, because she understood what we were trying to do and accepted that actually that was better than arresting people, because it accessed, the community drug and alcohol services to come in and deal with the incident, talk about drugs, make someone aware, harm reduction, or routes to mental health, or routes to homelessness, or routes to a food bank, or routes to domestic abuse support and sexual health and sexual violence and vulnerability, the whole package of interventions. So just to be succinct, we launched the scheme, and then the newspapers picked up on what we were trying to do, and they said, and the front page was police go soft on drugs. And you hear this a lot, but we returned a reply very, very succinct in that there was nothing soft about preventing death. And what we're trying to do is to reduce drug-related deaths, in a generational sense. But ultimately, we wanted people to be aware of what they were taking, receive treatment if that was what was required, but just to destigmatize drugs and widen that access point to recovery treatment. So that was it. And then you had a cohort of police officers who were going to use the scheme, who had doubts in their mindset, going soft on drugs, or we've always done it this way, where enforcement always arrested people, and then the what if questions. What if we arrest someone for cannabis and they've got a kilo of heroin at home or something? It's things like that, and you have to begin a process of trauma-informed training. So you have to help police colleagues understand we have the highest number of drug-related deaths on record. We have significant inequality and racial disproportionality, and this is the effect of policing. And this is the other side. This is where the evidence base, points towards better outcomes for the individuals, for policing, better outcomes for the community, and also quick and easy for the police officer. And when you mention it's quick and easy for the police officer because the community are dealing, they're like, well, actually, I'll listen. I'll give this a go. So yeah, it was mixed. It was somewhat adverse to begin with, but then when you present people with evidence in a dispassionate way, look, we're doing something sensible. We're doing something that's not to be frightened of. We're doing something that's academically robust. Let's try this, and that was the route to diversion.
So that is quite a process, and let me unpack it just a little bit to drive home some of the points. So you saw a local need, and you saw the way that the local need could be served. You knew that you needed to have national authority, and so that is where you invoked the Prime Minister, their ministers, and you were able to do that when you had that hard-hitting story in the news. That opened that door for the national authority. You also needed to have buy-in from the community. So of course, the newspapers picked up on this. They were kind of stuck on the war on drugs theme, and you had to quickly shift that public messaging. And then you also had to make it relatable for your officers. And so one of the ways, is a very practical matter, is that this will make your job better. It will lighten your workload. It will, and I think that is very compelling. Within the law enforcement system, within the court system, even within healthcare systems, we know that there are individuals that repeatedly are coming in on an emergency basis. And so I think all of these systems that are involved in deflection can certainly relate to having a better wrapping around of these individuals to engage them in that full range of services, the initial interventions that are so critical, but including to support them so that they can engage in treatment and recovery activities and gain that independent stability. So really a multi-pronged, in the end, the goal is does, but it also makes communities and families so much stronger and actually safer, because some of the petty crime that accompanies substance use ends up being reduced.
That's right. Yeah, definitely. And then when you open the door, because whilst I opened the door to the drug service coming in, if that makes sense, that then enabled other areas to follow suit. So other policing areas, saw the benefits of what we were trying to do and replicated. So suddenly it became, almost normal. What we're trying to do wasn't, provocative anymore. It didn't agitate those corners of society who were idealistic anymore, because the argument had already been had. And it's, and when people see you're just trying to do what's right, you can't invariably go wrong. It's not about, I've had conversations in policing personally where, what I was trying to do was, to some police leaders, career limiting, or, that I would have senior colleagues say, well, you're not going to get promoted if you're trying to do this because it's controversial. Just go for an easier thing. And actually, well, it wasn't difficult to begin with. So, I was very committed to doing what's right. So what the message is, I'm potentially mumbling here a bit, but what I'm trying to do is to say that if you have an idea and you believe it's right and there's evidence to support you, then do it. Go ahead and open that door, because the community are just waiting to be let in.
Yeah. Let me ask you another question along those lines, because I think in the US, we've seen pockets of this happen too. We have 50 states. There's something that is called home rule. So people are very clear, I think, as you articulated earlier, that you have all these independent departments and they get to largely make lots of independent decisions. And now I lost my train of thought. So sorry about that. I had a great point I was going to make, and it slipped my mind. So
it's all right. It's a big old subject, isn't it?
It absolutely is. So let me shift to what I was thinking about before that thought popped in my mind and then left so quickly. You talked a little bit about barriers. and overcoming barriers. And you mentioned a few. Are there other barriers that you have and that you think other nations might face as well when they bring deflection into their communities?
Yeah, again, a really good question. So one of the first barriers, and I use that constant theme of the drugs model. So I had to analyze how many people the police were coming into contact with every single year. So over 5,000 individuals arrested for possession of drugs within our area, 140,000 nationally. So I then had to find a way where we could enable the drug services to actually deal with that pressure point. So policing suddenly were going to say, well, here you go, here's 5,000 people a year for you to deal with, to meet and provide an intervention for. And that's a significant pressure point on the drug services, who are only funded to provide a solution for a set number of people provisionally. So whilst they would be there and ready and willing to do this work, sometimes they're not capable because of the infrastructure is not quite there. And I think what we then had to do was to step back, and then I had to present an evidence base for the cost analysis. So within policing, we were suddenly going to save nearly £1 million a year for that number of people. And then I was able then to try find a cost to provide a new service for this 5,000 people, which was 1/10 of that. So already automatically my bosses in policing will say, excellent, this is going to be a huge cost saving measure. And then, but actually I was able then to say, but then you need to invest in this first. And it's that kind of sharing of co-commissioning budgets, basically working together. The police have a pot of money, public health have a pot of money, the charity sector might have a smaller pot of money, but coming together, we can enable these things. So that was the main barrier, was not politics, not perception, not stigma, but it was about how to make it happen. And funded public health were able then to work together with policing to share that burden.
So were you able to increase any money into this collaboration, which would be a collaboration of law enforcement or first responders and treatment and other community services? Or was it more shifting resources that were already there and using them differently, or perhaps a little bit of both?
Yeah, it's a bit of both, really. So not connected to this. So I'd love to claim credit for this, but nationally, there's been a huge shift now towards a public health approach to policing. And this is the mechanism as to why PTACC UK now exists in the entity that it does. So within the UK, there's a new strategy. So the new government from harm to hope drug strategy, diversion is now in there. It's concreted in there. And there are new combating drugs partnerships. So that's a whole system, organizational cross-cutting departmental cross-cutting, team of key stakeholders from across the system, so education, health, policing, local authority, every aspect of the community now involved in drugs. And all of those budgets are now being joined up. Co-commissioning is made greater. And that's not just because of the barrier that I experienced, but obviously that kind of joint commissioning will open up many opportunities for a range of different needs, health needs. Mental health are going to benefit because they have a wider pool of resources. Mental health practitioners that can now go and respond jointly with police officers. Sexual health or sex worker harm reduction outreach can now get there before the police officers. So the police officers can say, we've received a call from a member of the public that there's soliciting going on in this area or curb crawling, and now the outreach teams can respond. Things like, they're just two examples really, but it's not just drugs, it's about the whole system looking together about how can we provide an intervention for this incident. And if the intervention's there, the job of the police is just to open the door. That's it.
So you're describing the way that policy has come together, that there are multi-systems involved, that there is a collective view about funding.
Yeah.
Because in order to achieve these collective outcomes, and then also you talked about co-response. So really just from policy to funding all the way through operations, you have this multi-system approach in place that helps hold all these details together.
Yeah. And some of that was happening before, the word deflection really hit the UK. Some of these practices actually were happening before, and that's the same in other jurisdictions and areas. There'll be some really great innovative practice. And what I think is easy for me to do is to identify that. So PTACC UK meets bi-monthly, and we hear presentations from organisations that are really innovative and pioneering what they do, or their collaboration with the police, for instance. So there's a charity called Basis Yorkshire. They managed a square mile in Leeds for decriminalised sex work, and it was academically evaluated. The crime reduction was significant. The harm reduction was significant. Sexual crimes, the reduction was significant. The savings to everybody was significant. But most importantly, the residents benefited significantly. The police benefited significantly because they weren't having to deal with incidents day by day by day. And they really got to the heart of the matters that mattered the most, if that makes sense. So it's about coming together to really analyse what the incident really requires, and police are the last people most often that are required.
Beautiful, and that actually tees up the question that slipped my mind, but thankfully popped back in. So we were talking about having more and more law enforcement departments coming on board. And here you're talking about this great network of collaboration. What I'm hearing you talk about is also shifting expectations on outcomes. So if you're running a police department and you measure success as how many people did we take to jail and hand over to the court system, it'd be really hard to overcome that to encourage police officers to keep people in community and engage in services. So can you speak a little bit about shifting how you measure success and outcomes in a police department to incorporate deflection? Yeah,
well, that's a really great question, and tricky, really, because it's multifaceted. So in the UK, we have, and this goes back, disjointed, but this goes back to that point about, how does deflection happen? So in the UK context, we have the lowest level outcomes. So an example, so when a police officer finds someone with drugs, they have to record it. They have to make a crime record because that's the national crime recording standard. What we do now is we use a community resolution, which then leaves no criminal footprint on that individual's outcome. There's no arrest, no interview, no admission of guilt required, just the drug is seized and the community then step in, the drug service. That's the lowest outcome we currently have. There's a newer one that is not widely used, an outcome 22, which is effectively deflection. And there's another one, which is pure deflection. And this is what we are driving here in the UK, is that we want incidents to be, if they have to be recorded or a record made, as a non-crime police incident, which never reaches any form of standard reporting. So because to reduce corruption and increase our ethics and accountability and transparency, policing have to be formal. They have to, if they're called and they deal with an incident, they have to make a record, for honesty, clarity, and everything else, and also accountability. And that builds trust and confidence in the community. So it's a two-way street, really. It's about recognizing the lowest outcome, and when it comes to key performance indicators, say number of arrests or charges or number of incidents the police have dealt with, actually what might happen, as happened in Leeds, so with the legalized sex area, the police suddenly had an increase in sexual assaults and sexual crime reporting. The reason why was because suddenly sex workers trusted the police. They trusted the environment to report what was happening So the police were shocked because all these crimes went up, but they were actually seeing for the first time the extent of what was happening. And that is really powerful. So sometimes, there will be unintended consequences, but the outcomes for the individual and the community are far greater than any kind of performance figure. And you have to be alive to that, or truly understand what that statistic is beneath the number.
That is so helpful on a lot of levels. One, you helped us explain different levels of approaches. So even though there are national mandates to seize drugs and make a record of that you found a way for that to coexist with that health approach so that you can still engage the person in the services that they need so that the drug use does not continue. I think it was also an excellent point to realize that as that trust is increased through accountability, so when you are making a record of all of your encounters, even if it's for deflection, that now the community is building trust. It may come to the police more often for help and assistance because now there's that transparency and that accountability, and there's a demonstration of the commitment to helping the community in needs that maybe traditional policing didn't allow. I would also assume, and you can correct me if I'm wrong here, that when police officer performance is being evaluated, Jason, you mentioned before, I was told I would never get promoted, that this would not be a good idea for me professionally. And so I wonder if that also, as more records are being made and congratulated and feeding into desirable outcomes that are, being applauded by your policy and your collaboratives, that actually will become something good that becomes part of a police officer's record. So the number of arrests may go down, but engagement in deflection services would increase. And overall, that is going to be more consistent with the outcomes that the department is looking for.
Yeah, this is where, and I'm eager to mention this actually, because sometimes, an innovative police officer may well be perceived by colleagues as quirky or different, or a bit of a renegade. I was called an activist, an internal activist, by a colleague, which I take as a compliment now. But importantly, there's a role of leadership, and I was only able to deliver change when I had the stars aligned with my boss, with the leadership pathway, with the politician, with the community, and so on. So those stars had to align quite neatly. What I found really beneficial was the role of the International Association of Chiefs of Police, so the IACP, and what that enabled was there's a network of senior police chiefs able to support what you're doing, because it's a platform of knowledge and experience and contact that you can draw upon. And I was quickly able to showcase, what we're trying to do within violence reduction, and other colleagues who linked and connected in with the IACP, and it was able to help us. What I'm trying to say is that is international. That network of supportive colleagues, serving or retired, are still there to support that individual officer create change. It's really important. Seek help where you can, and the IACP are one of those. And obviously PTACC US were there for me, and ISUP, and other local charities like Release Drugs, Transform Drugs Policy Foundation. All of these organizations have networks. It's really important to tap into that.
And I'm going to shamelessly also brag about our strategy area and encourage people to join. That was one of the things that, deflection happened internationally. I think, we can't pretend like the United States was, had the first police department to figure this out, but it really grew into a field and a movement, and it was growing internationally. And we're recognizing that international space through the strategy area that you and I co-chair. And so we are continuing to develop resources such as this webinar. We're also developing other, substantive resources that can be shared to help build that network. And also, the collaboration with colleagues. And as more and more people join the strategy area, I think you and I would love to host those conversations with our attendees so that we can learn more about what's happening in different parts of the world. How do we overcome some of these barriers? How do we impact strategy at the highest levels? And how do we feel supported by other colleagues that are doing the same work? So, Jason, I know you've been a wonderful part of PTACC US and the strategy area. And I know you would love company from other countries as well. And we fully are excited to see that growth happen.
Yeah, definitely. And one of the most helpful things recently, just to, chime on your point, was I took part in a call last week with Wisconsin, and the whole partnership were dialing in to provide updates. It was an hour led by someone in justice, Brad. I don't know what his specific role was, but his network was really beneficial. I took half a page of notes to come away, with ideas and, helpful hints and tips. What the structure PTACC provides is an inroad to get that help and support and knowledge. It's really beneficial. I can't, thank PTACC enough really for that, that knowledge hub of expertise, colleagues just like I was, experts, specialists, but members of the community too. There's help. There's definitely help out there. It's really useful.
Well, and I think that's why, as a strategy area, we both agreed that it would be helpful to have this kind of a conversation for someone who, is maybe in your earlier stages where you heard this great presentation, you're so excited, it's exactly what you wanted to do. You have the naysayers asking, how can we do it? We're not allowed, we can't afford it. It will kill your career, like whatever those early messages were. We want to be able to support the collegial development of programs and also, national development. And that's something I'd love to switch to now. So, Jason, you and I want to make clear for our audience, you can have Deflection without a national chapter of PTACC. The United States had Deflection efforts, and then there were so many, we found that it would be helpful to get us all together. And PTACC includes people from law enforcement, first responders, treatment providers, community service providers, really any organization. We have some government organizations. If anyone feels like they are wanting to support the field of deflection, they're welcome and they're invited to attend. I'm not going to say how many national leadership partners we have because I know that will become dated, and but we have well over 50 at the moment. And I'm sure by the time you're hearing this webinar out in the future, it'll grow even beyond that. So let me ask you this. There's the development of deflection as a practice and a philosophy and even a program, and that can all occur without a national chapter. So how did you know that the UK was ready and actually needed to take that next step, which would be to formalize PTACC UK at the national level?
Yeah, good question. I wanted to initially help colleagues like myself or people with an ability to create policy change. But first, what I needed to do was to, on a national scale, was to find a role for where PTACC could sit comfortably between public health, policing, and the community, so the intervention providers. So as I helped to build up the coalition, if you like. So I presented PTACC to the national strategy leads, and they found a real use for what we were saying. There was a real need to access intervention providers and also, crucially, people with lived experience, because they're very absent from policy making positions. So I was able to bring and sandwich all of that together. So PTACC UK was an instant fit, if you see what I mean, between that structure. That sounds really complicated, but it wasn't. It was really straightforward to just find a position and bring a big network together and meet regularly and hear about innovation and progress and connect that with the national strategy. So it's a two-way street of information, really, from A to B. So that was the mechanism, and obviously I was able then to bring the principles of deflection in to what we, to guide what we're trying to deliver. And, and the rest is history. And we were able to have our launch late last year in the House of Lords, and the venue also added significant credibility to what we're trying to do. So this isn't just some kind of wish list. I could be replaced by anybody with the principles of deflection. This isn't Jason Q. This is a movement about the community becoming, to responding way before the police. That's it.
Beautifully, beautifully said. And I think, the way that this has grown organically speaks to what deflection is. We are wanting to move people out of silos, right? Defending your budget, defending your practices, doing the, referral to another system, but not really collaborate and have those, what we would call in the US, a warm handoff, and remaining part of the discussion to make sure those warm handoffs are working and that people aren't slipping through the cracks. And so for you, it sounds like there was already some type of coordination and collaboration. So that was helpful. So for another country, deflection could be the first opportunity to try to collaborate, or deflection could be an additional opportunity. Maybe there were some other alternatives to arrest or conviction or punishment and incarceration in place. And so this can now be built upon that effort so that you have more coverage across the justice continuum. It could be a conversation that starts taking place in another initiative or in another policy circle. And then when it grows to the point where you need your own meeting, to be able to learn from each other, to understand what the innovations are, to support each other, to learn what's happening. That's often what I find in communities, that you don't even realize what's happening in the community until you have a chance to get together. And then certainly if the community now is interested in having this approach, it gives them a place to come and learn and be supported in the growing stages as well. Definitely. Well, let me ask you, we are getting toward the end of our time, and I would love to open this up for questions and answers, but I have two more questions last for you, or two more questions for you. One is, what advice do you have for others that are in your earlier stages? Maybe they've watched this webinar or they've attended some other events. They're really excited. So what advice do you have for someone to get this started in their own communities and countries?
Drop us an email. Honestly, drop us an email and talk to us, or talk to an organization in your area that you think will work well with you, and have an idea about what you want to try and achieve, and then build from there. It doesn't need 100 people to do this. It just needs one mind, or two or three or four. It'll grow organically. So trust in what you're trying to do. Reach out to us, or reach out for help, or speak to anyone in civil society to build that momentum. But have a look at what's out there. And I think the PTACC website has resources. Click through those, and again, we can send you those if you're remote and can't access them readily online. Or alternatively, if you do have online capability, then reach out, research, and follow the links. What I'm trying to say is just give us a ring, or email us, and we'll help. That's the bit of advice. Perfect.
That is perfect. And then, so Jason, you have achieved a lot in a very small amount of time. And I know that you, just because of the kind of person you are looking at how things can continue to grow and build. So what's next? What are you looking forward to doing to build upon the efforts that you already have in the UK?
I think link back to that previous answer really is just, I want to help other areas, other jurisdictions, and and help grow. I want to help, simply and succinctly, I want to help open that door to the community coming in way before the police. It would improve trust and confidence overnight. It would improve outcomes for the community and individual overnight. So they are, you don't need complicated policies. You don't need complicated, expensive interventions. You just need people willing to do the right thing. That's it. So that's what I help. I just want to help people.
Excellent. And what I'm going to do, we don't have a chat feature in today's webinar, but I want to make sure that everyone is going to be able to get in touch with PTACC. And so you can certainly Google PTACC, PTACC. And my guess is right at the top, you will hit our website, but if not, you can also type in ptacccollaborative.org. It's PTAC, and then the word collaborative, COLLABORATIVE.org. And in there are only two C's. So PTACC and collaborative share one of those C's. Again, ptacccollaborative.org. That will give anyone who's interested more ways to reach out to become part of the strategy area. So you can talk with Jason and I and our colleagues on our regular calls. You can also find out more about deflection and events. You can look at recorded events, resources, all the things that Jason mentioned. Jason, is there anything else that you would like to share that I didn't ask you about before we open this up to audience questions and answers?
No, I think I'm just really grateful to PTACC, not wishing to, plagiarize this or in any way, but PTACC have been a real monumental help. I think it's been so easy to get that kind of, connection and networking, and just I want to pass my thanks back to say thank you for the help you've given us, and that's really brilliant. So thank you very much.
Absolutely. Deflection was formed by a number of committed individuals that looked at something where a different approach was needed and tried out. Like you said, it doesn't have to be a monumental effort. You try it in your own place. You try it in your own community. You get things going. You learn how to establish those connections and collaborations. And it is tremendous, the exponential growth that deflection has experienced in the United States as well as globally. And Jason, we couldn't be more excited to watch things grow in the UK and to work with you as a colleague and a friend. And I think it's a very friendly bunch, and we very much enjoy working together.